in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight,
He's got a traumatic brain injury.
a head-on collision leaves a man fighting for his life.
We have to presume he's bleeding in his brain.
Multiple stabbings in a nightclub,
Hey, right, my name's back with the ambulance, mate, all right?
a child has a deadly allergic reaction,
Can you do this medical alert? This swelling is getting more pronounced.
and a motorbike accident leaves a man in agony.
We'll just keep it in mind, open pelvis.
So I've checked the critical care drugs. I'm happy with those.
Lovely.
You've got all your armoury there, Mark.
That's fine, I'm happy.
It's Saturday night in Oldbury, and Dr. Mark Nash and critical care paramedic Colin Apps are about to start a 12-hour shift.
You could argue that Saturday nights people are more likely to be out having a drink, enjoying themselves, and therefore later on in the evening we might get some fights. Road accidents increase when people have been out drinking, but yes, there are possibly certain patterns to what we might see on a Saturday, but we will go open-minded to everything like we always do and see what happens.
Ambulance service. Is the patient breathing?
I'm a taxi driver. I've seen a just accident on by the mosque before the roundabout.
Okay, and how many vehicles are involved?
Just only 1 vehicle. Is there someone in there as well?
Is the person breathing?
1 second. Hello?
Hello, is the patient breathing and conscious?
No. There's one patient. He's grunting. His hands are cold.
Is he awake?
No.
Okay.
Non-responsive.
Is somebody starting CPR?
Yeah.
Is he trapped within the car?
I think you'll need to take the roof off to get him out.
We're coming on blue lights and sirens as quick as we can, okay?
No, that's all, thank you.
Police, fire brigade and the ambulance service are all en route to the scene. But with a man's life in danger, Mark and Colin are also needed.
Never good, never good. Road traffic accident, I think car versus wall. Good mixture of things coming through, giving us unconscious and giving us cardiac arrest.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Immediate police and fire to my location.
Sounds a bit panicked.
Apples keep outside, just confirm. Police are en route.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
No, it's on scene. So there are cars in front of this thing. Just be aware there's people there. Yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Line across
car, GCS 3.
Okay.
So we've ripped tonight.
Cheers.
Got a massive heading.
Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cole, do you want to do after drugs and yeah, cool.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here. I think we've got enough space here, haven't we?
Yeah, we do it here and then...
As they prepare to perform this major life-saving intervention,
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? No. Mark, they nearly got him strapped on, so we might as well just lift him up onto there.
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Cole, you can just stay there and just rotate round, can't you?
Ambulance service, the patient breathing.
I've got two stabbings. Yeah, two stabbings. One is stabbed in his back. One of my bridges is passing out.
Sir, listen to me. I don't know if I'm to breathe.
Please help me, man. My bridges are dying, man. Please. So guys, so yeah, we got that stabbing. It's a double stabbing in Wolverhampton. We're running at a channel 81. If you're over the clear and start heading that way, that would be great.
Yeah, send it on us, mate. We're good to go. I'll change over channel now.
Police and ambulance have been dispatched to the nightclub where the attacks have taken place. Reducing the number of deaths from stabbings is one of the critical care team's main objectives. So paramedic Ian Locke and Dr. Ravi Chauhan are also en route.
The fight is still going on at this location. So offenders still on scene, fight going on in the background.
For Ian and Ravi, being called to a stabbing is far from unusual. In the West Midlands, there are around 60 stabbings a week.
Well, so the update from there is there's a large fight and reports of 2 people stabbed. The fight is apparently still ongoing. So.
With the attackers still believed to be on scene, Ian and Ravi wait until the police give them the all clear. West Midlands Ambulance Service deal with around 1,000 casualties from road traffic incidents every year.
I've lost count of the amount of fatal RTCs that I've been to in my ambulance service career.
Rescuing the injured in these fast-moving, dangerous environments relies on absolute teamwork from police, fire brigade, ambulance and the critical care team.
We've got 2 OMs running on this and a total of 3 DMAs and yourself, over.
Working with other services, you know, that it's not just like one person, it's just like everybody doing like a little bit. And actually, when you sort of step back and you see it all sort of unfolding, it is really good. And like, they're like some of the best in the country, so you can't really ask for a better bunch to work with.
Check the battery on this before we do anything else. Battery's full, that's good.
39-year-old Pete Edwards has been part of the critical care team for the past 2 years. Like all team members, his specialist training means Pete has the skills and equipment to treat critically ill patients, often making the difference between life and death.
This is something that you'd see in hospital every day, you know, this sort of equipment, as are these ventilators that we have in this blue bag. You know, it's stuff that's frequently used in hospital, and it's now coming into the pre-hospital setting as well. This can be used to take away human error sometimes, or to free up a pair of hands. You know, you don't have to focus while this is doing what it's set up to do. You can concentrate on something else, so quite handy.
Ambulance service, is the patient breathing?
Yes, he is breathing. A motorbike police has been thrown off his motorbike.
literally in the other lane. His bike at the central reservation is actually in the opposite side of the road, going the opposite way. He's not moved since he's been knocked over.
No. And he's still in the other lane. He's still in the middle of the road.
He is. He's in the middle of the road, lying on the floor in the oncoming traffic. He is breathing, but he's in a lot of pain. He can't feel his hip. Pain in his right shoulder, right knee, right hip, and left knee.
Has he taken his helmet off?
No, we haven't. It's still on. Yeah, is that good?
Yes, leave the helmet on.
A serious motorcycle versus car accident can be a code red emergency. An ambulance has been sent, but critical care backup is also needed.
Minimal protection on a motorcycle. I mean, the head's obviously protected with a helmet, but the rest of the body's exposed, and even the helmet, I mean, with a decent enough impact, it'll still cause a really significant head injury. Some of the things we always look out for with a motorcyclist is a fractured pelvis, because that can be quite rapidly life-threatening. How you doing, all right?
So we've got Ian here.
Ian. Hello, Ian. I'm Pete, one of the CCPs.
So at the moment we're complaining of right shoulder pain. That's his biggest pain area that he's got at the moment.
Yep.
Right hip, left knee.
On the busy A34, a car caused 53-year-old wire fitter Ian to hit the curb, throwing him off his bike across the grass verge, narrowly missing the oncoming traffic.
I know it's painful. I'm ever so sorry. We need to get you out of the cold. We're just going to lift you up, get you in the warm, we'll get you something for the pain, mate, all right? He's come quite a distance off his bike.
The ambulance crew members have immobilised Ian's neck and spine. If he has broken his back, moving him risks damaging his spinal cord and leaving him with permanent disabilities.
I'm just going to let control know what's going on from the scene. 7062. Number of patients is 1 motorcyclist. So far complaining of pain in his right hip and right shoulder. We're just going to get him on the vehicle. We'll do a proper assessment once on board and get you an admit shortly. Cheers. You all right, mate? Do you know him? Is he your dad? He's all right, OK? We've just got to have assessed. He's been knocked off his bike, but he's talking to us, he's conscious.
Ian's concerned son has arrived on scene. He was called by one of the witnesses to the accident.
Don't worry, we're going to look after him, all right? And we'll get him sorted. Ian, mate, where's the most...
The slightest movement has Ian screaming in agony. The signs are this could be a very serious injury.
At the moment, I'm concerned about his pelvis because he's complaining some pain in the hip on the right side. If anybody's in a position to start while they're stripping off, get some obs. Shall they? OK. We'll just keep it in mind, open pelvis.
An open book fracture of the pelvis is one of the deadliest injuries because the pelvis contains major blood vessels, which, if damaged, can lead to significant blood loss and cause the patient to go into shock and die.
Yeah.
Lots of flags.
Critical care paramedic Ian Locke and Dr. Ravi Chauhan are en route to a multiple stabbing. A fight has broken out at a crowded nightclub, leaving 2 victims in its wake.
Right, back away, or we're not going nowhere, yeah?
The scene is too dangerous and volatile for our crew to continue filming, but Ravi's body cam keeps recording the unfolding drama.
Cheers, mate. All right, thanks, mate.
Despite the danger to themselves, Ravi and Ian know if they don't treat their patients quickly, they could die.
He's got 2 stab wounds to his lower back.
OK, yeah.
There's one with a single stab wound to the upper thorax at the back.
OK.
There.
Buddy, hey, right, my name's with the ambulance, mate, all right? Just have a little seat for me, just so we can have a look, mate, all right?
A single knife wound can sever a major artery, causing death within 5 minutes.
I'm blessed, man. I am blessed. Not blessed, man. Not blessed. I'm talking here. I'm blessed here. I can walk. I can walk. I'm blessed. I can go home. I'm blessed. I can go home. I'm blessed.
2, there and there. OK.
Just sit here for a second. Just
Just sit here. All right. Just lean forward.
Put a little dressing on your back, all right, mate?
I'm all right, mate.
Yeah, mate.
No, you're not. You just...
Ian needs to check the first victim to determine whether his wounds are life-threatening.
All right, just relax for us, mate. OK.
But it's a tense and aggressive situation.
You don't stab me, though. My fucking mum got shot, that's
Right, not now, you won't. Not now, buddy. Not now. Just relax, all right?
Just look. Just listen to us. Just sit down. All right. Let us just do what we need to do. All right.
The man has 2 stab wounds and needs hospital attention, but Ian's assessed his life isn't in immediate danger.
You need to go to hospital, mate. You need to go to hospital, all right? You do, mate. You do.
Nothing do it.
Yeah, we're just going to go and look at him, mate.
They move on to find and assess the other stab victim.
You all right, mate?
Okay, fair enough.
Yeah. What's happened? So he's been stabbed right now. Okay, fine. Just take this off for a second, mate.
Whoa, wait there, what?
Huh?
Just 1 second, please.
Yeah, just take the whole thing.
Yo, who's that?
First aid, the ambulance.
You can't be touching me like that.
Calm down, man. Just relax.
Boss, you can't be touching me like that.
Okay, all right.
The wound is close to both heart and left lung. At the very least, there's likely to be internal bleeding.
Just sit back for a second.
I can't.
Yeah, I need to just have a look.
Let him do his job. He needs to
He's the ambulance, man. He's checking that you've got no other injuries.
All right. Are you finding it difficult to breathe?
I can't breathe.
Okay. All right.
I'm sorry.
That's all right. Sorry, I need you to sit back for a second.
Whoa, wait there. No. Boss, it hurts.
Okay, it hurts on this side, yeah?
Hurts.
Okay, take a big breath in.
I ain't from paper.
Okay.
The wound may only be an inch wide, but Ravi knows it could have caused significant damage.
Keep that on for a second. You all right walking out?
I don't know.
All right, I'll get you a chair. If you get a chair, mate. He's got left side.
Okay.
He's got worsening, like surgical emphysema, starting to swell around his back.
Okay. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
Listen, what I need you to do, I need you to get into this chair. Right, we need to get into the ambulance quickly, all right? All right, sit back.
2 stab wounds, here and here. 1 stab wound right arm. Issues, he's been GCS15 throughout. Last blood pressure was that. He's had a gram of TXA, he's got IV access there. He needs to go on the back, he needs to go up to QE. I'll get some fluids and keep an eye on him.
Outside, Ian hands over 1 victim with multiple stab wounds to the ambulance crew.
Should we go with that one?
Both he and Ravi will travel in the other ambulance with the more seriously injured victim. They take him to the Queen Elizabeth Major Trauma Centre in Birmingham. He is one of 5 stabbing victims that are treated here every week.
I'm feeling a little bit precious this morning.
Starting his first shift back from holiday is critical care paramedic Ryan James.
So I'm hoping for a nice little relaxed shift, ease myself back into the working week. But you know, I would think with my luck, we're probably going to be pretty busy. Because it's always the case, isn't it? If you want a nice ease back into your working week, then it's never going to be. 7062.
Just checking you there, you checked and all of that business over.
Yep, I'm here, matey. Good to go. Look after me today. It's my first day back off my holiday. Received.
Hello, you speak to the ambulance services for patient breathe.
Yeah, he just walked out and fell right over. He thinks he's broke his ankle. He slipped on the ground, it's wet.
And it's his ankle that he thinks is broken?
Yeah.
Has he got an obvious deformity?
Have you got an obvious deformity on it? The bone popped out. It's deformed.
Did he say it's going the other way?
He said it's deformed.
We will be there to him very shortly.
Yeah, okay then.
According to the update that I've just received, this gentleman has got a angulated complicated fracture. Basically, his foot is facing a different way to where it should be facing. And we have got some alternative analgesia that the crews don't carry in the form of intravenous ketamine.
With complex fractures, there is a risk that the deformed broken bones are interfering with blood supply to his foot.
The crew's still not acting, so no updates for you, but I'll keep you running over.
6-2, Roger, all received.
Ryan may have to perform an emergency intervention to realign the foot, an agonising procedure that requires skilled use of high-strength sedatives.
What I shall do is we're just pulling up in about 30 seconds. We'll go and have a chat, see if we can assist.
It looks like he's not going to get the post-holiday easy ride he was hoping for.
Here we go.
The critical care team and Midlands Air Ambulance serves a population of over 6 million people.
Punctured, a 13-year-old male, jumped query fallen from an upstairs window.
It was set up following a study on trauma survival rates that found providing hospital-level care and decision-making at the roadside could save more lives.
Bringing the hospital to the patient, that has a really high impact on patients, such that you can get them to hospital in a much stronger and more stable position than they would otherwise have been.
In Wednesbury, 8 miles northwest of Birmingham.
Right, guys, so current plan, you're doing a grand job. What we're going to do in a minute is we're going to go up onto the trolley there.
Dr. Mark Nash and critical care paramedic Colin Apps are trying to save the life of a 38-year-old driver who is unconscious with a serious head trauma and may be suffering from a potentially fatal bleed on the brain.
Colin's going to be on the right-hand side with all the airway kit. What we're trying to do is we'll just move the monitor down to be alongside. Is that okay? Does it make sense? Yeah? Cool. So I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Cole, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in the end. There's the KY.
Suxamethonium and rocuronium are two fast-acting muscle relaxants that will temporarily paralyse the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now. We don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. You happy at the top end? Yeah. Cool.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. I'd say if anything he's doing abnormal flexion, isn't he? Right, monitor wise, just want to look at the monitor. So just run back on. So we've got ECG on. I'm about to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah,
Trying to take the mask off, I think.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything's very cold. It's a heart. Right, this is going to be a token 50. Okay, and Sucks is going through now.
The dose of Sucks will take a minute to take effect.
Okay. It's quite swollen now.
Let me know when you're ready to...
Yeah, that's the drug kicking in. Quite slow circulation, right, actually.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralysed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, already?
Yeah, he's got just a large epiglottis.
Okay, bougies through, ready for the tube.
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie out. Okay, right. Again, yeah, got good movement. Okay, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. Okay, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
Okay, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
Right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So, male, unclear of the mechanism. There seems to be cars involved.
Mark updates controls so they can alert the hospital.
He has, looks like an open brain injury. As far as we can see, there's an injury to his back of his head, which definitely was a flap of skin, and so he's got a traumatic brain injury. So we have to presume he's bleeding in his brain. So he's now been RSI'd. ETA, I think we're going for 15 minutes. We'll say 15 minutes.
15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess. Once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there, the longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to these sick patients, work with the crews on infrequent events for them, but frequent for us.
12 miles away in Cosley,
hello,
critical care paramedic Ryan has just arrived at the home of a man who has badly broken his ankle. The bones are protruding through the skin.
What's happening? Hi, Adrian.
He slipped outside and he thinks his ankle displaced. He's not sure whether it's gone outwards or inwards.
Sure.
47-year-old Adrian lives with his parents. After he fell, he managed to drag himself back inside and his father called 999.
Not the Sunday morning you were hoping for, then?
No, not really.
No.
Tatty's ready.
I know, I've just noticed you've got your Sunday roast all prepared, ready to go.
Knew we were coming, didn't we?
A complex open fracture must be quickly realigned to prevent serious infections and re-establish blood flow to the foot. It's a procedure Ryan has done many times.
He's clicked it 3 times back into alignment.
Have you actually? What, before these ladies got here?
But today, his skills won't be needed.
Wow, mate, I can't believe you've put that back into alignment. You know. What made you do that, do you think? Was it just hurting too much, or?
Yeah, well, I thought I was trying to get up.
Yeah.
And I thought, I ain't going to get up without it the way it was. So
Yeah. How far angulated was it? How far? Really?
Yeah, well.
Blimey. Back old school treatment. I don't even know why you needed us to arrive, really.
Adrian's dexterity has served him well. Incredibly, he managed to manipulate the bones back into alignment himself. A delicate and agonizing procedure that usually requires high-strength painkillers and sedatives.
You're a brave chap. I'm surprised you haven't just called a taxi and hobbled on in there. There you go. Right, hold that on your mouth and nose. Make a tight seal. That's it. And then just breathe that through. And then we'll get you to a state of mind where you're not worried about what we're doing, and then we can pop your foot on that splint and get you splinted. Do you want to do leg or splint?
Happy his pain-tolerant patient doesn't need any advanced pain relief, Ryan continues to give Adrian gas and air to take the edge off any discomfort he may feel.
Happy? I'll go above and below. You slide it up. Okay, I'm just going to lift your leg up now, okay? Nice deep breaths. Nice colour, nice circulation. Keep going, keep going. You've got the old, that's it, on the outside. Right, what this is just going to do is just going to tighten up around your leg and go firm, okay?
To stop the bones coming out of alignment on the journey, the ankle is encased in a vacuum splint.
Ready, set, lift. That's it. Keep your arms in, mate. Happy? Ready, set, lever.
Once he's on the ambulance,
All right, ladies, take care. Nice to meet you. All the best, mate.
Ryan is happy to leave Adrian in the care of the crew while he gets ready for his next emergency.
He's clicked it 3 times back into normal alignment before the ambulance crew and myself got there. So pretty impressive, really. Strength and determination of Adrian to be able to have done that to himself, you know, is commendable. You don't see that very often.
Ambulance service, did the patient breathe in?
Yes, it's my 2-year-old daughter.
And what's the reason for the call today?
She cannot open eyes, full swelling on her face.
And it's her whole face that's swollen?
Whole face, especially eyes. Now she wants to sleep.
Okay, if you pick her up, does she go limp or floppy like a rag doll?
Oh, yes, everything. Yeah.
Everything's floppy?
Yeah.
Okay. Has she had a very severe allergic reaction before?
Never, ever.
We have got that help coming as quickly as we can.
15 days later, patient has bilateral wheezes and evidence of facial swelling.
So have we got any history on this address, what they're allergic to, ever?
Can't see anything in the video, mate.
No worries.
An ambulance has been dispatched to the address, but a 22-month-old child suffering severe allergic reaction is a code red emergency, so critical care paramedic Steve Mason has also been scrambled.
If they've got facial swelling, you need to be concerned about, you know, the airway being closed and then that compromising the patient, because obviously they haven't got an airway, they can't breathe, and there's some abnormal soundings on this patient's lungs. So a wheeze can indicate that, you know, the airways are quite tight and constricted. So, well, it can be life-threatening.
The child's worried mother has reported her breathing is laboured. Steve knows in these emergencies every second counts.
Ian, have you got any medical problems?
No.
And have you got any allergies?
No.
Can you lift your right leg up a little bit? Yeah? Nice, okay.
In Birmingham, Ian, a 53-year-old motorcyclist, has been thrown off his bike, and critical care paramedic Pete has not yet ruled out a fractured pelvis, which could be life-threatening.
Sorry, and your right leg? Is that any pain?
Yes.
Where?
Here.
Okay.
Up here, mate.
I suspect it's more hip at the moment. He's moving all his limbs, he's lifting his legs, which is, because we were concerned about his pelvis, but he can lift his legs, which I think that's a positive sign in terms of hopefully it's more hip than it is a true pelvis injury. But where's that pain, Ian, in your hip?
Yeah, you see that there.
And again for me.
Yeah.
Ian, can you turn this foot, can you turn it to the side? He's able to rotate it. Yeah. And this one, and can you try and lift it again a bit?
That hurts.
Where about? Okay, relax. He's holding his leg up. Okay. So like anatomically, he looks in line, his lung bones are intact. So if anything, since the time we've been with him, his heart rate has actually gone down. Yeah. So I think if that was pelvis and he was bleeding, his heart rate would go up potentially. He'd look pale and sweaty. He's not. He can lift both legs, and I think the pain is more on the side. So I think that's more hip than it is a open pelvis.
Pete doesn't think this is a life-threatening open book pelvic fracture, but without the benefit of an X-ray, he can't rule out any other fractures.
That's it. I'll keep his. Probably there's another one here. Yeah.
Which one, right?
Ian's right arm and shoulder are giving Pete cause for concern.
Bear with us, Ian. Is it the shoulder, Ian, that's the worst? Ian?
Yeah.
It's the shoulder, yeah?
You have to excuse my language, but I ain't gonna be quiet with it.
All right. Ian, bear with us. We're going to get you some pain relief as soon as we can get to one of your arms, mate, all right?
I mean, just in his position,
yeah,
it looks lower than the left
shoulder
at the minute.
He's got severe pain in his right shoulder, so I suspect he's got a fracture dislocation somewhere there.
No.
Details of how the crash happened will help Pete understand his chest and shoulder injuries.
Rough idea, Ian. Do you know how fast you were going when you collided with a car?
No.
And did you go through the air, or did you slide across the floor?
No, I hit the cone. As soon as I hit the cone, I lost it. Hit the cone, hit the curb, and then I just fell off the bike.
So you've just fallen off, you didn't go like flying through the air, you don't?
Yeah, hit the curb, I just slid.
And it sent you up in the air, did it?
Yeah, you can see I don't know whether it went over the handlebars or I just couldn't save it.
Okay, no worries.
You can see the scrape marks, as I say, on the road.
Take a big deep breath in for me. And out.
Ian's breathing is normal, but he has a suspected dislocated shoulder and a hip injury.
Can I just confirm that with you? IV paracetamol, 07-2021.
Yeah.
All right. Okay. And we found no other injuries, have we?
Pete contacts control, who will alert the hospital of Ian's arrival.
So yeah, what I'll probably do then, we'll send him to Sandwell, and I think I don't need to travel. Bye-bye. Okay, I'll leave you to it. All right, nice. Thanks a lot. All the best, Ian. Take care. See you now. He did have a lot of protective gear on, which is a good thing, but we still have to be really cautious about injuries and, have a high suspicion. We're a bit concerned about his pelvis, but what we class as a true life-threatening open pelvis fracture, I think that's unlikely in his case. If he's got a shoulder dislocation or a fracture, we're going to get him to the nearest hospital, which is a trauma unit, so they'll be able to deal with him.
Hi, you all right?
Yeah.
In Smethwick, Steve has just arrived at the house of 22-month-old Anit,
Every day.
who has a wheezing chest and an increasingly puffy face.
It's got a lot worse in the 10 minutes.
What has she sort of been allergic to, do you know?
All indications of a serious allergic reaction that needs emergency treatment.
The only thing that she's had is Weetabix.
Weetabix, okay.
We don't know anything else to, obviously, what it could be, but she had Weetabix last week and was fine, wasn't she?
Every day she had
Every day, yeah.
Driving, she had every day, so both things normal,
Okay.
never.
Has this happened before at all, or?
No, my
No.
other daughter had this reaction before because she had a reaction from nuts, but not she, never had.
Okay.
After her usual breakfast, Anit's face started swelling and she became worryingly subdued, so her mum rang 999.
So we're happy with her sats at the moment.
Yeah.
So I think what we'll do, because unsure what's going on, if we just head to the children's now, yeah.
Although Anit seems very calm, allergic reactions in children can quickly escalate from mild itch to life-endangering anaphylactic shock.
We'll just take her in.
I just said it is quite a bad reaction, you know.
Okay, jump on. Well, there's nothing to worry about, Mum, okay? I'm just going to take him to the right hospital, just for be assessed, okay? Okay. Yeah, whenever you're ready, yeah.
Can you sit there, please, Mum? Is that okay?
If her condition worsens, the best place for Anit to be is in hospital. So Steve decides to get her there as quickly as possible with minimum fuss and intervention.
Oh, dear me. Can you do this medical alert, please?
He will make the 3-mile journey to the nearest children's unit with Anit, calling control to prep the hospital for her arrival.
A 22-month-old. She's developed a sort of swelling to her eyes and to her sort of face area. This swelling is getting more pronounced, so we're just going to alert back into Sandwell, please. And we'll be at Sandwell in how long? In about 5 minutes. And this is unlike her to be nice and calm like this. Yeah, so her eyes have developed since I've been here a little bit, yeah.
It's developed quite a bit.
Yeah. She just looks a bit uncomfortable with all the itching. If that swelling gets really bad, affects the tongue, closes off the airway, then you've got a potential airway issue. You've got no oxygen going into that patient. If the airway completely occludes, then, you know, what we need to do is try and act on that quickly to sort of stop that. So you said your other child suffers with this?
Yeah.
What has she been diagnosed with anything at all, or?
She had allergic from nuts sometimes.
Nuts?
This kind of allergy I seen on her.
Okay, and does she carry an EpiPen around with her? And
She's normally fit and fine, so the thing never, just once she had allergy from that.
Okay, no worries.
In the last 5 years, the number of children hospitalised with life-threatening allergic reactions rose by 72%.
I'm concerned that she's got some swelling going on, so she's got a reaction to something. So whatever's going on, you know, it is looking at. She's a bit uncomfortable because she's scratching. You like Canada?
Arriving in hospital, Anit is carried through to the waiting paediatric doctors.
Really, with that patient, I think the more we would have done to her, the more stressed she would have become. So, hands-off approach, let her watch something on the phone, and she was nice and calm all the way in. Then we just got her in, which was great.
In the intense world of medical emergencies,
1 patient, 3 times stab wounds.
there's nothing more extreme than a code red.
accident is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got one male still trapped in the vehicle.
In the West Midlands, a highly specialist team is ready to race to these major traumas.
ETA in 4 minutes.
By road and air.
03, we are lifted from Cosford.
Responding to the most severe 999 calls.
Open up the Lucas device over there for me.
Day and night.
All right, well done.
From car crashes
Just need to check.
to stabbings.
We're going to put some oxygen on you, pal.
Here, where time is critical, lives will be saved. On roadsides and inside homes.
It's okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery, normally only seen in operating theatres, to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed alongside the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll, ready, steady, roll.
Tonight,
Were you thrown at all?
Yes.
Yeah?
a man is in agony after a motorbike crash,
Mate, this is the worst thing I've ever done.
a cardiac arrest in a supermarket,
If she has another arrest, you're going to do 3 stack shocks if needs be, okay?
a race against time to save a man's foot,
What we could do is to pull it to a better alignment.
90 degrees isn't good.
and a car crashed into a lamppost, trapping a child inside.
I know it's going to be a bit painful. Just bear with it, be strong, okay?
The critical care team in the West Midlands was set up in 2012.
Police are now on scene saying it is a significant wound.
Thank you, speech soon.
70% of the doctors on the team are consultant anaesthetists who also work in hospitals all over the region.
We're basically a specialist team, effectively. West Midlands Ambulance Service will respond to between 3,000 and 4,000 calls a day, and the trauma service is commissioned really only 10 patients a day.
There are 34 full-time critical care paramedics who have each undergone a rigorous selection process before a further 18 months training.
So this is our mechanical CPR device, which can take over chest compressions, which is especially handy if we're transporting a patient on an ambulance.
Right. Ready for another thrilling instalment? See what the world has got in store for us today?
40-year-old critical care paramedic Stephen Mitchell, known as Mitch, has been with the team from the beginning.
When you've just enhanced the team or become a team on a job, you know, it does make you proud to be part of the system, and it's a good feeling, I suppose.
Ambulance service, is the patient breathing? Well, I think she's fine. She's something to blue. Is she awake? Hello? No, she's not conscious. Is her breathing noisy? Yes. I need you to look at her chest for me to see if it's rising and falling regularly. She's breathing, but she's grunting, breathing in the face. We are coming as quickly as we can, okay? Ambulance and siren.
An ambulance has been called to a local supermarket where the woman works, and Mitch has also been scrambled.
Chris has just given us an update about a job that's in Albury, somebody who's collapsed in a supermarket. I believe it's cardiac arrest. Crew's 5 minutes away, or were 5 minutes away. They should be there by now. But really, these patients need quick management.
Without a heartbeat, the human body can store between 3 to 5 minutes worth of oxygen. But after that, the brain and major organs begin to shut down.
Night, night.
I've just been to crew in hospital B, and when we brought confidence there's no one to change it up down that, you know.
Do you know an approximate age?
There's no age, there's no details at all.
With no information to go on, Mitch and the ambulance crew must act fast if the patient's life is going to be saved.
Londis here. You're right. Oosh.
5 minutes after he received the call, Mitch arrives at the scene.
Okay. You're right, guys. How you doing? Keep her on the side.
Yeah. She's had 3 shots.
Oh, yeah.
Yeah, no drugs given. GCS on Thursday now.
You've got just a normal O2 mask. That's it. We'll just get a free flow.
45-year-old employee Jo was at work stacking shelves when she collapsed. Luckily for her, the ambulance crew arrived within 2 minutes and managed to restart her heart.
Hold on, guys. Okay. She's got a candle in.
Yes, she's got
So, keep her on the side there.
Family behind.
Yeah, gotcha.
And then work colleagues.
The paramedics have hooked Jo up to an electrocardiogram, which shows a very agitated heart rhythm.
That 12 lead, did you see anything on it? Came back steady.
Mitch knows there's a real chance she may rearrest again at any moment.
You okay?
Daughter-in-law, are you a daughter-in-law?
Yeah.
Come here. Okay. What's the name?
Jade.
Jade. She's obviously had a cardiac event where they've had to defibrillate her, okay? So she's quite poorly, but we're looking after her. It's good that she's away.
Yeah.
Jo's brain was deprived of oxygen for several minutes, which has left her confused. Mitch needs to calm her down to minimise the stress on her heart.
I need you to sort of be around and talk to her. So if you go behind my colleague there, you just talk to her. Just.
We've got Jade here for you.
Jade's there.
The team now need to get Jo to hospital as quickly as possible. It's her best chance of survival if she does have another cardiac arrest.
It's the ambulance, okay? Just. So.
Nottingham making a multiple request for ambulance and fire brigade.
Yes. Operator, hello, caller. Is the patient breathing?
I'm not sure it's a car crash, but they're stuck in the car.
How many vehicles involved?
Just one.
And what have they actually gone into?
Come off the road and gone into the curb and hit a lamppost. One person's stuck inside. He's in a lot of pain.
Is that him screaming?
Yeah.
A major road traffic collision requires all the emergency services working together to save lives.
On it.
The critical care team on duty tonight are Dr. Ben Taylor and critical care paramedic Aidan Brown.
Patient still trapped to the left knee down. He's an 11-year-old male with the back of a
The passenger trapped in the back of the smashed vehicle is a young boy. A child's life is in danger, and Dr. Ben knows there's a lot that can go wrong.
Well, obviously, it's a very cold night tonight. It's 4 degrees Celsius.
Physiologically, children are different from adults. They get colder quicker. They tend to compensate very well physiologically in terms of blood pressure and so on until they don't. So they've got the potential to become sicker very suddenly.
The police have arrived on scene, along with the fire brigade and ambulance crew. It's a big impact smash, and the boy's condition is deteriorating fast.
That's all received, many thanks. We're just approaching scene now.
The critical care team in the West Midlands was set up to improve the chances of survival to hospital for seriously ill and injured patients.
Monitor on there, oxygen down there.
Yeah, perfect.
Together with the Midlands Air Ambulance, the highly qualified doctors and paramedics fly around 6 missions a day.
03, we are lifted from Cosford.
Covering an almost 6,000 square mile region.
ETA 10 minutes.
On the ground, they rely on a fleet of high-powered vehicles to get to each emergency in the fastest time possible.
Turn right here.
Will Meadows has recently completed his 18 months advanced training to become a critical care paramedic. As this is one of his first shifts, he's being accompanied by Colin Apps.
I've been working for West Mids for about 19 years, but Midlands Air Ambulance for about, I think, nearly 11 years now. Today, I'm just doing a support shift for Will, so...
You're my mentor, my role model and mentor.
I'm not getting involved. I'm happy to sort of stay quiet in the background.
Be calm, mate. Ambulance service, is the patient breathing? Fuck, yes, this is a serious cut to his right wrist. Okay, is he conscious? Yes. Will I be able to speak to him? No, he's in. Just ask him how he's done this. Have you got, mate? Cancel. No, mate. They're coming as quickly as possible. Is the gangrene a face? Is he a deathly colour? Oh, Jesus. Yes. Relax, yo. Keep supplying that pressure until we get there. They're coming on a blue light.
An ambulance has been called, but the man's condition is so serious, critical care backup is needed, so Will and Colin are also en route.
So it's a 26-year-old male who's sliced his arm with a tool of some sort, bleeding quite heavily, and apparently he's now unconscious.
If the man's unconscious because he's losing too much blood, he could be about to go into cardiac arrest.
He's had to be put on the floor, legs raised. There's a crew only a couple of minutes away, so we should get an early update.
They're gone. There's 6-2 get hit.
6-2, I've just spoken to the crew. They say the patient was in the street. They've got him onto the back of the ambulance. He's GCS 15, but looks very grey.
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will. Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm. Okay. We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got my first set of obs done now. Just got him inside because it was so cold, really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Joe, we're just going to slide you back, my darling, all right?
In Oldbury, Mitch is working with the ambulance crew to get 45-year-old supermarket worker Joe to hospital.
If you're happy, mate, what we'll do is we'll just pick her up and then someone feed the stretcher straight in so we're not all like... Right. Well done, guys.
She has suffered a cardiac arrest and is fighting for her life.
You okay, Joe?
Her daughter-in-law Jade is also on scene.
Can you just carry on talking to her, Jade? That's it.
She went to the doctor yesterday. She had pain in her arm.
Pain in her arm.
But she couldn't get an appointment.
You okay, Joe?
So everybody on the side, pull apart slightly as well. So, and then just watch everybody's toes. Okay.
1, 2, 3.
Okay. Advance. Mind your toes.
Go on,
okay, lovely. Okay, so guys, can we go a little bit further over that way, and then put her on a side? Okay, because if she vomits,
It's 26 minutes since Joe had a cardiac arrest, but Mitch knows the window for her rearresting is still wide open.
Have we got a little cushion for her for underneath? You know, can I just insist that we keep her on the defib? Sorry, we need to know what's happening, don't we?
The cardiac monitor contains a defibrillator, which can be used to deliver an electrical shock if her heart rearrests.
You ready for a quick update?
9-8, yeah, go ahead. I've got Rocket 1132, if that's correct.
Yeah, female, appears to be in her 50s. I can confirm some details, but looking to go to PCI centre. Would you mind just seeing which is the closest? We're thinking city.
6 minutes after he arrived on scene, Mitch has his patient packaged and ready to leave. He radios control to report on her condition.
Yeah, currently GCS 14, heart rate 120, BP 11886.
You are in Old Blanc, you say yes, I'd agree that probably City is your closest.
Nice one. Cheers, Mucker. Yeah, we'll alert direct and appreciate it for that.
There is a real chance of Joe re-arresting, so Mitch will travel with her to continue giving emergency care throughout the 4-mile journey.
So, guys, what we're going to do is, if she has another arrest, we're going to do 3 stack shocks if needs be, OK? Happy with that?
Yeah,
OK.
Sorry, Joe. Joe, how you feeling? In pain.
Liam, just nice and smooth, mate. What we're going to do is we're going to do a cannulation in a bit, but I'll tell you when it is and we'll just pull over slightly, OK? OK, we're just going to put a little needle in your arm, OK, lovely.
The cannula will allow Mitch to administer painkillers directly into her bloodstream, as well as prepping her for immediate treatment at hospital.
Yeah, that's probably from the compressions on your chest. Going to get you sorted, lovely. You're doing really well, OK.
Just 4 minutes later, they arrive at hospital,
Good skills, top marks.
where Mitch delivers his still critically ill but now stable patient to the waiting emergency doctors.
From when we got there, we were met by the crew and they'd reported that they'd just got a ROSC on her, so that sort of really changes the game plan for us. The crew were like literally 2 minutes away, delivered the shock straight away. Her heart was in such a rhythm that it gives the potential to go back into cardiac arrest, and there is like a window of where the heart is like sort of agitated and actually it's quite likely they may go into arrest again. But on the same note, it was like a really good outcome.
Ambulance services, the patient breathing.
Yeah.
Are they awake? Are they conscious?
Yeah.
What's happened, sorry?
We're on a roof. It's a dislocated.
It's a dislocated ankle.
With a possible break, yeah.
Is he able to talk to me, or?
Yeah, you are able to talk.
So what happened? Did someone just tackle you, or did you...
Someone just...
Does your foot look cold, pale, or blue?
It's covered in a sock and a boot.
Would you say you're in severe pain?
Yeah.
If the man's ankle is fractured, the broken bones could cut off the blood supply to his foot. A time-critical injury that must be treated on scene. So critical care paramedic Pete Edwards is en route.
So we're going to a male in his 40s who apparently has a fractured dislocation of his ankle. There is a crew in attendance who are requesting us, so I suspect it's for advanced analgesia.
The critical care team is trained in the use of high-strength drugs and painkillers, normally only used by doctors so they can carry out procedures in the field.
The ambulance crews carry gas and air or Entonox. They carry IV paracetamol and IV morphine. And then we carry ketamine, which is a much stronger pain relief that gives sort of sedation as well. This is it.
9 minutes after he was called, Pete arrives at the rugby ground.
Hello. Hello, all right.
The ambulance paramedic updates him on the man's condition.
So far, Entonox on the field, onto the stretcher. It's giving me a score about 5 or 6 at the moment, but that's because it's not moving.
Okay.
You can feel sensation all around it. It says it just feels like pressure.
Hello, sir. I can see the problem.
40-year-old Dave was playing a friendly match when a nasty tackle floored him. He was carried from the field by the paramedics and given gas and air for the pain.
Yeah. And we've got a little bit like what looks like some critical skin there, haven't we?
The fracture is so bad that the skin around the ankle bone is dying because of the lack of circulation. If it continues, he could cause lasting nerve damage and he could lose his foot.
Dave, You've obviously got a fractured or a dislocated ankle. Looks like there's a little bit of compromise to the skin because of the bone. What we don't want it to do is the skin over the joint to sort of die or become necrosed, really. What we could do with it really is to pull it to a better alignment.
90 degrees isn't good?
No, I've seen better. I've seen better. I'm going to just uncover you a little bit, all right, so we can get to you. We've got a couple of options, haven't we? We run with it like that on blue lights into the manor, or we could give him a little bit of ketamine and just pull it, you know, to get rid of that critical skin, because obviously that's time critical, isn't it, really?
Administered correctly, ketamine will allow Pete to perform this procedure, putting the broken bones back into position and restoring the vital blood supply to Dave's foot.
Big deep breaths, that's it, all right?
I've got an 11-year-old male in the back of here. He can't get out he's mechanically trapped from the left leg down. We haven't been able to see anything below there.
In West Bromwich, Dr. Ben Taylor and critical care paramedic Aidan Brown are at the scene of a serious car accident.
I'm going to have a quick assessment, Ben.
A child is trapped in the wreckage with potentially critical injuries. With the temperature near freezing, they need to get him out as quickly as possible.
My initial plan at the moment is once that's all released and clear, look at sort of how he's actually mechanically trapped. If worse comes to worse, it goes a bit downhill a bit quickly, what we'll do, we'll get the telescopic ramp down through the middle, rapid.
That's your plan B, smashing. No worries.
I'm just going to have a go round and have a quick look at that leg, all right?
The police, ambulance service and fire brigade are working together to free him.
Hey, bud. How you doing? My name's Aidan. Right, I'm just going to have a quick look at your leg, OK?
When the car smashed into the lamppost, the front passenger seat was forced backwards and is now pinning the boy's leg to the floor.
Mate, can you just cut that off your scissors, mate?
Before they move him, Aidan investigates his trapped leg.
Yeah, mate, it might be broken, OK? So bear with me, OK? I'm going to have to move it. I know it's going to be a bit painful. Just bear with it, be strong, because as soon as we get you out, we're going to give you some strong painkillers.
Getting him out without making his existing injuries worse is going to be a delicate operation.
I think we've got enough room to manoeuvre your leg now. Right, all we're going to have to do, mate, I'm going to lift your leg, OK? We're going to have to get you to shuffle to the back there, OK? So if you want to start shuffling your bum across, I'm going to support your foot.
We'll look after you. It'll hurt a wee bit, but
all
we'll
right,
get you
mate, I've got it. I've got it.
Well done. You're doing very well there.
Well done.
I can't move because it's
Clue.
Frightened and in pain, the boy isn't able to move.
Let's just relax it there a second. Just relax it there.
But Aidan can't wait any longer. This is time critical. The boy has now been trapped for over 42 minutes in the freezing cold and is in extreme danger of becoming hypothermic.
We just get the longboard, like...
Can we get your longboard out your truck, please?
Yeah.
Thank you.
Ben?
Yeah.
And a back splint.
And the back splint, stand by.
Come Mohammed, mate. I'm going to have you out in the warm in just a second.
Aidan oversees the fire brigade as they prepare to get him out.
Yeah, don't worry, we'll help you with that. I want you to lie your head down there for me. I've got your foot. Lie your head down. Well done, mate.
Longboard in position, the crew can now manoeuvre the boy out of the wreckage.
You guys happy there?
Once the feet are clear, you can pendulum them in.
OK, and we want him off the longboard, so we'll need to basically hold it at the side and slide him across if we're happy.
Here we go, mate.
Ready, steady, slide. Well done. Second, OK, get you nice and warmed up, all right?
Finally out of the car, the crew lay the boy on top of the stretcher.
Any pain up here? No? OK, any pain down there?
Yeah. Aidan assesses him and confirms his left ankle and foot are badly damaged, with potential multiple fracture and dislocation.
We'll get him in the warm first and we'll do it from there if you're happy.
The blood and nerve supply could also be compromised.
Let's go in there. I bet you're cold now, aren't you? You've been a brave lad, haven't you? Very brave. We're just going to go into the ambulance now. You see your fam. All right? Good man.
With a temporary splint on the injured ankle and wrapped in a foil blanket to try and warm him up as quickly as possible, the boy can now be moved into the back of the ambulance.
Any pain in your chest? No?
Aidan carries out a thorough examination of his chest and vital organs to be sure he hasn't suffered any undetected internal injuries.
But I'm happy that it's isolated.
Happy, like,
tib fib.
Ben, happy for us to clear Drew can transport it out, I thought.
The boy is now in a stable enough condition for Aidan and Dr. Ben to leave him in the sole care of the ambulance crew for the 8-mile journey to Birmingham Children's Hospital.
Took a little bit of time to get him extricated from the vehicle. He's got quite severe lower leg fractures, which will need treatment at a specialist trauma centre.
It's difficult when you go to a child that's the same age as one that you have at home, and it brings home a little bit closer and breaks through the veil a little bit. It's bad enough for an adult to be in that position where they're trapped inside a crashed car, probably very scared, probably getting cold, probably in a lot of pain. But as a child, it must be significantly worse and significantly harder.
Yeah, it's
quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But it looks like it.
In Birmingham, critical care paramedics Will Meadows and Colin Apps have been called to an accident on a building site.
How old are you, sir, mate?
26.
So it's a tool that sort of dropped onto his arm.
Yeah, plunge saw.
Like a table saw.
Rich was operating a mechanical saw which got caught in his clothing. The wound is so serious, he's in danger of losing some of the use of his arm.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
I could fully grip that.
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
Yeah, a little bit. A little bit.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm, and he sustained an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue, and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There's no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's go. Look, I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
You get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go.
Take care, get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew.
Is it okay to pop him on just a little bit of oxygen? Is that all right?
8 miles away in Walsall, following a bad tackle on the rugby pitch, critical care paramedic Pete Edwards is about to try and realign the broken bones in Dave's ankle.
Have you ever had ketamine before?
I've had morphine before.
Yeah?
It's been over 40 minutes since the accident. Deprived of blood and oxygen, healthy tissue can suffer irreparable damage, so Pete needs to act fast to restore blood supply to his foot.
He's got dislocated or fractured ankle or both, but what we've got is what we call critical skin over the joint, and that means that the skin is that tight, it's restricting the circulation to it, and it is quite important that we restore circulation. So just going to get a little bit of sedation, try and pull it straight and get into the hospital as quick as we can. Have you given it some Danzatron or...?
Before Pete injects the ketamine, it's vital he gives Dave a dose of anti-sickness medication to help him tolerate it.
All right, to give him a bit of that, just... Is that all right? His observations are all right, aren't they? So that's ketamine, 10 milligrams per mil, so in here is 200 milligrams, all right. Have you seen it given before, Stu?
Ketamine?
Yeah, OK, all right, so it's just have to be no sudden noises. All right, I'm just going to go some very small amounts to start with, all right? And it's Paul, isn't it? I might just feel a bit woozy, that's all right?
More nervous?
Yeah, don't worry, all right, OK. Right, we're going in very small increments here, just to gauge a response, all right? Give you a really small dosage.
The skilled and effective use of drugs like ketamine is a vital part of the critical care team's training. In the wrong setting, it can cause unpleasant psychoactive disturbances, so keeping a calm, controlled environment is very important.
I'll just give that a minute or so just to work in.
As the drugs start to take effect, Pete closely monitors Dave's reactions.
You hear me, Dave? You hear me?
Yeah, okay.
Yeah? Lift your arm.
Pardon?
Lift your arm.
Lift it.
Yeah. OK, all right.
It's a difficult judgment. Not enough, and Dave won't be able to tolerate the pain of manipulating his ankle.
Just give him a little bit more.
Too much, and it could suffer the adverse side effects.
All right, Dave.
With the ketamine now in Dave's system, he is hopefully oblivious to what's going to happen.
OK. I'm going to give it a little go at that, all right? You might shout.
Pete needs to proceed very carefully. There are 3 main bones in the ankle. They could all be broken. And they all need to be correctly aligned if he's going to reverse the damage done by the lack of circulation.
All right, Dave?
Oh, all right.
OK, that's a bit better. OK. That looks a bit better alignment. Skin colour's going back as it... Let's just check for a pedal pulse. So just check, yeah, the critical skin has gone. I've got a good pedal pulse. Cap refill on his foot, although it is cold. OK. Shall we just pop a vacuum splint on that then? And I think that's all good.
It's worked. With the bones now realigned, blood is circulating properly to the foot.
Dave, all done.
Yeah, it's looking better.
So he probably doesn't. He's answering us, but I don't think he knows.
Is that normal for the ketamine?
Yeah, that's a good indicator that it's kicked in. Yeah. You can pop that oxygen mask back on him just for a sec. I mean, he's satisfying, but.
Pete encases the ankle in a splint to create a rigid support for the journey to hospital.
Now he's relaxed. Look, it's come back. There we go. OK, yeah. I'll put a bit of traction on, and you put that vacuum splint on. Yep. If we just keep our eye on it. Super. So I can see it. Skin's good. OK, that's lovely. So Walsall Manor, innit? I think we're quite happy now. We've got rid of that critical skin, so we could just have a nice steady ride in.
Pete will travel in the back of the ambulance with Dave to keep him under close observation while he is still under the effects of the ketamine.
Are you warm enough?
I think so, yeah.
Yeah? Do you know where you are now? No? It's good stuff, isn't it, that?
Kind of feel floating is the
Yeah,
easiest way
yeah.
to describe the way it feels.
It can take several hours for ketamine to wear off, but Dave shouldn't have any memory of his ankle realignment.
Do you feel like you need anything else for pain, or is it OK?
No, it's okay. It's nice to be able to see that my toe is now actually...
Pointing the right way?
Yeah, up my other than pointing...
Yeah, it didn't look very good, did it?
No.
We're here now, Dave. You'll be glad to know, all right? Bit of fresh air might just make you feel a bit better as well.
Maybe light-headed.
He had a little bit of a moment where he was as high as a kite, for want of a better description. He seemed a bit bewildered, you know, what's just happened and where am I? But after a bit, slowly, he was back to as he was as normally, so it was a good result.
We joined together, didn't we?
On this team, yeah, we did. It's just short of 2 years, isn't it?
Yeah.
In the critical care car, paramedics Sarah Foley and Becky Chappell are on their day shift.
It's nice to have the option to do something slightly more, isn't it?
Yeah, definitely.
I think once you've had a few years as a paramedic dealing with general treble 9 calls, it's nice to specialise your skills and increase your knowledge in one specific area and be able to target it. Variety is the spice of life.
Ambulance services, the patient breathing.
Just had an accident. Can't through his foot.
Okay. Are they breathing at the moment?
He's breathing at the moment when he's in the middle of the road.
So what's happened?
My driver just pulled out and he's just flying. And he's ripped the whole skin over his foot.
Was he on a motorbike or a push bike?
Motorbike.
Is he bleeding very heavily?
Yeah.
Puddle of blood around.
Fucked up around it. Ankle's literally gone. It's cut open and, you know, showing to move.
Is there any complete or partial amputation?
I'm not quite sure, sir. I can't see it. Is the ambulance on the way, yeah?
Yeah.
Right, Delta 98.
No, you're not too far from this. Think about 4 minutes. It's RCC, roadside will be car.
That's lovely, thanks Steve, we'll go and have a look.
When a car hits a motorbike, injuries can be complex and life-changing. An ambulance has been dispatched, and Becky and Sarah's enhanced clinical skills are also needed.
All we know at the moment is that there's a leg injury. Somebody's come off a motorcycle, only 2 minutes away.
At the scene, they are briefed by the ambulance crew.
Hi there, you all right?
He was on his bike.
Yeah.
And a car turned right in front of him and he started to come off the bike. And I think he might have fractured his ankle.
No KOs?
No.
No.
20-year-old Jake, a restaurant assistant, was riding home from the motorbike test centre when he crashed into a car. The impact dislodged his boot, throwing him off his bike onto the road in a hard landing that caused several gashes to his foot and injured his ankle.
You felt down all his back and neck and he's got no pain? Yeah, no, as long as you're happy. Can I just have a quick look at it? Would that be all right? You've got no pain anywhere else? No, okay. Were you thrown at all?
Yes.
Yeah? You got no pain higher up in your legs? It is just
that's my
here?
most concern.
Yeah, all right. We'll be able to wash that once you're on the ambulance.
Motorbike versus car, no loss of consciousness, appears to be an isolated ankle fracture. No further resources required. Going to grab him on the back of the ambulance and fully assess him.
You're right.
Oh.
Ruling out further serious injury, Sarah needs to get Jake onto the ambulance to carefully assess the damage to his ankle and lacerated foot.
I'm going to just let go of that for a moment. All right.
Out of 10, mate. How bad is this hurting you?
Oh, fucking 11.
10 is the worst pain you've ever had in your life. 10's me cutting your arm off.
Mate, this is...
It's right up there, yeah?
This is the worst thing I've ever done.
Can I cut these before the cannula goes in? Is that all right? It just makes life much easier.
I'm terrible with needles.
Right.
We need to get some pain relief into you, don't we?
There we go.
That's the only way we're going to manage there at the minute.
Okay. Right.
Before Sarah and Becky treat his injuries, Jake needs a cannula inserted into the back of his hand for intravenous pain relief.
Oh, mate, give me a sec, please.
But Jake has a fear of needles.
Shit with needles, like absolutely terrifying.
Just talk to me about what happened.
I've just come back from Sutton Coldfield because my theory test is tomorrow for my motorbike.
Okay. How fast were you going?
I was going about 30.
About 30. Okay. Just look down towards me. So you were going about 30. Were you wearing a helmet? Yeah. And your jacket, is that the only jacket you had on, or?
That jacket, I'm on motorbike jacket.
Yeah.
He's just come straight in front of me and I've gone in.
You've gone into the side of him then? Because he's gone in front of you?
I think, yeah, morphine and paracetamol. You're okay with paracetamol? You haven't had any in the last 4 hours? Okay, this is just normal paracetamol, but we give it IV and it's actually far more effective giving it IV as a painkiller. Okay, so that's 2021 paracetamol running through. Okay.
The intravenous drugs have been administered, but are going to take a short while to kick in.
My lovely, I'm going to just lift this up from here, okay?
In West Bromwich, critical care paramedics Becky Chappell and Sarah Foley are at the scene of a motorcycle RTC.
Just trying to work out what he's grazed and took the skin layers off.
As well as an ankle injury, 20-year-old Jake has a badly lacerated foot. The critical care paramedics are concerned the cuts are so deep they may have exposed bone that could become infected.
Okay, it's just that one really.
A bone infection can be difficult to treat and in extreme cases life-threatening.
That's the one, that's a little bit deeper down here.
Just trying to work out what he's grazed and took the skin layers off and what could potentially be bone.
Got good circulation, so he's got good pulses, the capillaries. Yeah, let's just put a bit more on. Hurting. Yeah.
12th of July, night.
Are you all right to hold that, Beck? Yeah.
Both IV paracetamol and...
Oh, I'll leave that up to you, please.
Yeah,
Satisfied that his wounds haven't revealed the bone, Sarah decides Jake needs an X-ray to check for any breaks.
I think, because we've covered the wounds, he's got such a large haematoma here. Well, we can try it and we'll leave it open over the haematoma then. Okay. And if it eases the pain, great.
A haematoma is a pooling of blood that has leaked from a damaged blood vessel into the surrounding tissue. To ensure the injury is stabilised and the bone supported, Sarah puts the ankle into a vacuum splint for the journey to hospital.
You ever had one of these before? I've never broken a bone in my view or anything like this. We're going to do this, we're going to suck the air out of this, so it's going to go real hard around your ankles so we can't move, okay?
Confident Jake's injuries are not life-threatening, Becky and Sarah are happy to leave him in the care of the ambulance crew.
Jake, all the best. Okay, we'll leave you with these guys. Obviously, just tell them if you need anything further for the pain. All right.
Thank you.
Okay. No, thank you. Yeah, and you guys. He's very lucky, really. He's come off a motorcycle, and at the moment, it looks like he's got an injury to his foot. So it could have been far worse.